And so people probably have heard of PRP for, hair.
For hair,
regrowth,
knees,
or
for facial aesthetics, yes. But that concept has been around for a long time, like orthopedics, they'll do it for the knees, for dental transplants, right hair, face, sexual wellness for men and women. But the idea is it's very healing. Why not do this intravenously? That's a novel concept with PRP. It's been around a long time. So what we're doing here is a very specific dose to you. So we have a platelet counter. So the initial blood we took, we got a baseline. Okay,
Cool.
Based on your symptoms and your health history, there is an algorithm and dose we want to meet. So else that will give us the dose specific to you.
Okay.
And so we'll concentrate that and we'll confirm that we got the right dose, and then we'll give it intravenously.
Perfect.
So it's going to help with your immune system. It's going to help recognize and turn on the healing cascade. So with all the health issues you're dealing with, it will help your body kind of realign, rebalance, kind of like kickstart the healing process again. And it's your own blood. Nothing can heal the body better than the body can heal itself.
Awesome.
So that's kind of
And
the
we're
super
hoping
high
that
level.
this helps with Sjögren's symptoms. So any autoimmune patients, right?
Any autoimmune, it works great. It goes first to the brain, lungs, heart, then the periphery. So, and people ask, well, will I experience anything? So we're just gonna do it a little, so slow push. So you have the bell curve. Some people, we're gonna have you stay here for about 15 minutes, and you may have a shift, which means your brain function, you may feel a little tingly, you may feel, from the Raynaud's, sometimes you don't have the feeling in your feet.
Right.
It almost gives you like a neuropathy. That sensation may come back a little bit. Okay.
But the hope is that that symptom will go
It
away.
will help, hopefully, you can never say cure, but may help reverse, slow down the progress significantly. Again, this is a tool in the toolbox, which can move the needle further than other things can conventionally, even in functional medicine, because of its unique capabilities. We don't know everything about it, but I mean, the body, if it's out of balance, we're putting it back into balance and giving the body's innate ability to heal, recover, regenerate.
And why does the condensed platelet, why does that?
So it's the concentration. So we're taking out a baseline, and it's been about 45 minutes since we do the blood. So your body will reproduce that baseline. So the super concentrated amount that's going back in, you're waking up the body because the concentration is so high. Okay. That's the reason why.
It's so cool. Can my mom use that on her current scar?
I gave it to her to use. She got something. She's all excited because the dogs and everything that she's dealing with. That will help. That is the biopsy and the necrosis she had.
Okay, cool.
There, and then we're just gonna flush, just to make sure we get it all this back in.
So this isn't necessarily mainstream. So how would you find somebody to do PRP if you're, say, in a small town?
This is the thing. There are a lot of people that do PRP. Okay, there are lots of places that do that, but it's also the dose, the concentration, and this is the next level because they're using AI, machine learning, and a large database, and it's been refined to about a 95% accuracy.
That's really cool.
So ultimately, it can take up 2 months to 3 months to get the full results from the first.
But people can fly in and couldn't see you. They could come and do
but there
this.
are right now, I think about 52 clinics throughout the country. So from a grassroots level, without them doing any advertising, it's getting word. That's how I found it, from a grassroots.
Okay.
But with the first,
It's still relatively small.
it is.
Right?
Well, it's growing very quickly. Remember, it's a startup, been around since 2018, but in the last 2 years, it's really
Cool.
taken off. And they think they've done over 15,000 treatments to date. So, and no adverse reactions. Meaning, could you have a Herx reaction? Yes, that's a detox where you're getting kind of toxins. It helps detox, so you may feel a little fatigued, run down, brain fog, just real tired. So this is where we'll help you with some glutathione, NAC, some type of binder. We'll find something at the front to help with that. And hydration is going to be very, very key.
Okay, lots of water.
Lots of water. Right, so what we're going to do here is I'm going to pull IV out. I want you to put some pressure there for me. Just right there. Great.
Easy peasy.
Easy peasy.
Pumpkin squeezy.
Yep, so let me do this.
All right, so I'm going to be really excited to share what kind of ailments, symptoms are relieved.
Yeah. And this may require more than one treatment over a year, so that's something we'll have you follow up with me and we'll discuss.
Okay.
Plus, we also got your blood work today too, so, which is great.
Yeah.
They'll give us something else to talk about. So I'll probably see you sooner.
Okay.
10 to 14 days.
Okay.
We can, well, maybe next week.
Okay.
And then next week we can review your labs and they'll be a touch base
Okay.
for
Perfect.
the TruDOSE we gave too. So we're gonna have, we'll pay here for 10
All right.
minutes. I'll get the discharge paperwork and I'll come back and just see if these
Cool.
little